Today we're going to talk about the 5 different movement patterns that you need to be progressing if you're trying to beat knee pain for good. If you want to help support this channel for free, the easiest way you can do that is just like, comment, and subscribe on this video. Just help the algorithm out, and that'll help me grow. The first pattern we want to progress to is a step up onto a box or a bench, but we're not going to start there. We're going to start with some wall sits. Wall sits are something I've talked about a lot on my page, but really what we're trying to do is we're trying to isolate focus on the lower part of the quad, as well as the quad tendons and the patellar tendons. Why this is so nice is because there's no movement occurring, we're able to really challenge those muscles and tendons without putting a whole lot of stress on the joints themselves. So you can do them a lot and without a lot of excess soreness. Start by holding for 3 sets of 45 seconds with both legs, building up to where that's easier and more comfortable. And then you'll progress to a single leg version where you bring one leg into your center of gravity, then take the other leg off, building up to holding for 3 sets of 45 seconds here as well. So then we're going to go into low box step up, which is one of my favorite ways to progress into the full step up. You're going to start with a low box about 8, 10, 12 inches off the floor at most. And then you're going to start 1 foot up on top of the box, leaning your center of gravity over so that your nose is over your knee, is over your toe. And then it's all about building tension. So you're going to start pushing down into this box without creating any movement, just pushing as if you were trying to squish a bug under your foot, generating that tension until you feel like the large majority, 90-95% of pressure is on this front foot, and you can just gently push off the rest of the way. What we're trying to avoid is most people when they do step-ups, it's one of these, pushing off their back leg too much. So we're trying to eliminate that by teaching you how to generate tension through that front leg. What you should feel is a combination of that lower quad and the upper part of the hamstring, the lower part of the glute working together. This is a movement that you can spend a bit of time on, progressing gradually with more weight, more sets, more reps as you get comfortable. And then progressing into a full step up just looks like adding height. Next is going to be a glute bridge progression. I really like trying to get to a foam roller for my knee pain clients because we can get the calf and the lower part of the hamstring to work together to stabilize the knee, which is why we're going to start with a ball of the foot contact on that foam roller, pressing down through the foot to bring the hips up. This is going to engage the lower part of the glute as well as the hamstrings and a little bit of the calf all working together to stabilize the knee. There's 2 ways to do this one. I like doing it as an isometric hold, just like the wall sits, where you're going to build up to holding for 3 sets of 45 seconds at the top of that bridge, and then again progressing to a single leg hold for 3 sets of 45 seconds at the top of that bridge. Then we can add more load. Adding load here really just looks like doing a classic hip thrust, either loaded with dumbbells or a barbell across the hips. Progress this like any other strength movement, doing your 3 sets of 6, 8, 10, gradually increasing load over time. So next we have a split squat. Now most people when they hear split squat, they think of a Bulgarian split squat where that rear foot is elevated up behind you. But what that does is that actually limits knee flexion in that front range. So we're not actually challenging the knee all that much. With my knee pain clients, I like to do a front foot elevated split squat. All that looks like is again with a low step, probably a little bit lower than we did the low box step ups with. You're gonna have your front foot up on some type of elevated surface, back leg behind you like you would for a normal split squat, and then just straight up and down like an elevator. At the bottom, because of that elevated surface, that's creating more knee bend, which is what we need to actually challenge the strength of the knee. Add weight to that with dumbbells, barbells, kettlebells, just like you would any other split squat. Next, we have a classic RDL, which is a little bit less knee specific, but it's still gonna help build a lot of strength in the posterior chain to help your body overall reduce forces on the knee. So for my knee pain clients, I'm a big fan of trying to get to single leg variations as quickly as possible. And that still is true for the RDL. So what I'm going to do here is a kickstand RDL, where you take 1 foot back at about a 45-degree angle. Most of your weight is still on this front leg. And then you do an RDL like normal. Slight bend in the knee, pushing those hips back, just loading that front leg. Still progressing this like any other strength exercise, trying to get stronger here. Last pattern is working on the lateral chain, or the way the hips and the obliques are going to be working together to stabilize you when you're on one leg. There's a lot of ways that you can do this. That's where a lot of the classic banded work comes in, the monster walks, the clamshells. But today I'm going to show you a side plank variation that really lights up that side. So the exercise is actually really easy to set up. You're going to start in a basic side plank position, elbow, forearm directly below the shoulder. But then with the legs, instead of being out straight, you're going to have the legs bent. So knees bent at about 90 degrees, slightly forward in front of you. From there, you're going to be pressing down through this bottom leg, this bottom knee specifically, to push you up. This top leg is coming up, and now we're in a starfish position or whatever you want to call it, but you're engaging through that knee, which is going to create tension in the hip instead of the obliques like you typically feel like with a side plank. So pushing down through the knee, bringing yourself up to a hold, and then dropping down. Again, 2 ways to do this. You can do this for an isometric hold like you typically do with side planks, working up 3 sets, 30 to 45 seconds, adding weight on top of your hip when it gets easy, or you can do them for reps, where you're coming up and loading that position with a nice slow tempo and then popping right back out of it. I like both. You can mix them into your programs in both ways. If you like this video, remember, just please like, comment, and subscribe.